about Jan's presentation already. How's that, eh, for getting ahead of things? Well done. Okay, our next guest, ladies and gentlemen, is Caz Mason. She's the Virtual Emergency Care Service Manager with the RFDS for South Australia and the Northern Territory. A Royal Air Force veteran, Caz transitioned from defence into healthcare leadership through a 30-year nursing career across emergency care, high dependency units, occupational health and midwifery. During the COVID-19 pandemic, Caz led South Australia's rural and remote telehealth monitoring team, delivering virtual healthcare access across a footprint of more than 980,000 square kilometres. And today she manages the virtual emergency care services for the Flying Doctor, coordinating telehealth support for remote clinics and leading care delivery from the bustling metropolis of William Creek. Please welcome Caz Mason.
Good afternoon. Everybody still awake after lunch? Today we're going to have a look at the existing RFDS SANT telehealth network services, and then we're going to explore how the evolution of that service can benefit the Northern Territory. So what is virtual emergency care? Well, virtual emergency care services can provide an urgent medical care platform via telephone or an online platform. They unify video conferencing, on-site clinical diagnostic equipment, and essential medications with 24/7 clinicians to diagnose, treat, and monitor critically ill patients, hundreds of kilometres away from that doctor without delay. It's all a little different to 1928 when the RFDS commenced, and we used pedal radio systems, which basically makes us pioneers of telehealth without knowing what telehealth was at that stage. There are telehealth hub facilities positioned at 7 RFDS remote area clinics and 3 BHP mine sites, which facilitate the delivery of sustainable virtual emergency care service models and increasing access for remote populations to best practice emergency care. So where we started, this is our William Creek Virtual Emergency Care Centre, and we developed this in 2024 to imagine what emergency care could look like for outback communities. Now, William Creek is situated along the Oodnadatta Track, which is 850 kilometres away from Adelaide. And it has a day-to-day population of 15 people. So it doesn't really demand a GP surgery, emergency care facility that's manned. But at the height of the tourist season, they can see an increase up to 25,000 people. So there's definitely the demand for the emergency medical facilities, but in that kind of environment, how are you going to staff an emergency care building? You can't. So building on its long-established RFDS medical chest program and leveraging modern satellite internet, the RFDS created a prototype for delivering round-the-clock emergency care with no clinician in the room. In its first year of operation, the William Creek Virtual Emergency Care Centre saved 2 lives, and they prevented 5 aeromedical retrievals. Now, over a 10-year period, that gives a benefit-cost ratio of 33:1. And that was on a $2 million investment. Within that clinic at William Creek, they have a telehealth hub trolley. And that telehealth hub trolley houses some diagnostic tools. We'll come back to that. All of these diagnostic tools Bluetooth into the telehealth trolley. And they provide real-time results to both the patient and the attending doctor in conjunction with a face-to-face assessment. Now, when I say diagnostic tools, basically what we're talking about are all the things that you would find in an emergency department if you presented for an assessment. So a thermometer, a HD examination camera, blood pressure monitor, pulse oximeter, an ECG, and a glucometer. So let's imagine that you need assistance and you're 850 kilometres from Adelaide up the Unadata track at a clinic with no staff. How does that work? On arrival, the affected patient would ring a doorbell. Everybody's got a Ring camera these days. Pretty much the same concept. You ring the doorbell, but the person on the other end of that camera is actually in Port Augusta, 600 kilometres away. They have a quick conversation. Hello, what's your problem? Are you okay? Do you need assistance? The patient would then be buzzed into a little antechamber, which has a telehealth hub. And that's all done via remote entry. So the doctor is then informed that there's a patient in William Creek that needs assessment. They pop up on our telehealth hub, and they can do a face-to-face assessment and decide which diagnostic tools are needed to do a full clinical assessment of that patient to form a treatment plan. The same way as you would in the emergency department when you go in and a doctor or a practice nurse or a senior nurse would say, okay, so I think they're presenting with X, Y, and Z, so I need to do X, Y, and Z in return, blood pressure, ECG. It gives a full clinical picture of that patient. If that patient's clinical condition dictates that they require further assessment and treatment, then they can be buzzed into the treatment room. If their clinical assessment doesn't require that, they can be given some advice and sent on their way. It's great. But if they do need some further assessment, they'll be buzzed through into the treatment room where there's 2 beds. There's a green RFDS medical chest, which is in a very similar concept to the Northern Territory's white EMK, or white chest. And by now, we would have had a volunteer community first responder that would have attended to assist with any medications that would need to be delivered from the medical chest. We're really lucky at William Creek. We have volunteer first responders who actually work in the pub. And so they're actually informed by OCC at Port Augusta that they're needed in the medical centre. They go in, they have the key code to get into the medical chest and a padlock key, and they go in, they liaise with the doctor via the telehealth hub, and they can administer medication that's needed. That community engagement is essential. We couldn't make this model work without them. It means that we can commence early treatment that we would not be able to do otherwise. Now, aeromedical retrieval can be arranged if required, but we're a 90-minute flight away. So from Port Augusta to William Creek, it's still 90 minutes. That's a long time if you're that patient and you're lying on a trolley in an unmanned emergency department with a volunteer responder that only has basic first aid treatment. And so what we can do is make sure that that doctor stays on the line and continues a face-to-face assessment of that patient at all times. So, if we need aeromedical retrieval, there's our crew arriving. We're really lucky that the William Creek Clinic is built right next to the runway, and it's literally a short walk for them. But the logistics of building a $2 million clinic in every remote location that needs medical cover wouldn't be viable due to the cost, as well as the logistics of building a clinic in a remote area. So what can we do instead, and how can we make this care accessible? So, traditional telehealth hub in the William Creek Centre, as I said, consists of a telehealth trolley. Now, it's yay big, yay wide, and weighs 50 kilos. Not really very portable. So the RFDS, instead, can now expand the existing service to bring it to families and businesses in the Northern Territories. as a clinic within your homestead or as a mobile option. It's a very similar service, but with much reduced costs. We can provide a clinic in your own environment with a setup of a compact and secure office option. Now, it's a fixed wall cabinet, folds down, provides you with a tray table, and it completes with a all-in-one PC and camera, LED lighting, speakerphone, and all the same diagnostic devices that were in the original trolley, but with a much reduced footprint. Or we can provide a mobile backpack. Now, the mobile backpack version is designed for deployment across multiple sites or field work. It has a 13-inch tablet, which comes in a rugged carry pack, a speakerphone, and a dedicated patient camera. And both options use portable satellite connectivity, such as Starlink. So the virtual care backpack contains exactly the same diagnostic equipment as the office and the telehealth trolley. So a thermometer, a pencil examination camera for all the times that your children put marbles up their nose or have a bug in their ear, or the doctor wants to have a look down somebody's throat or have a look at possible dental problems. We have a blood pressure monitor, a pulse oximeter, an ECG for rhythm assessment. So it doesn't give the same as a 12-lead ECG that you would get at a GP or an emergency department, but it's enough to see if you have a cardiac arrhythmia. If you present with chest pain, really important that the doctors can assess that cardiac output. And there's also a glucometer for blood glucose testing. And in addition to this equipment, the RFDS will also provide a new automated external defibrillator, so an AED. Now, this is being launched as a NT trial, hopefully by July 2026, and it will integrate the remote diagnostic equipment into the existing NT Health's telehealth system. So we're not providing a new service, we are adding into the existing service. So it's just going to give an additional layer of clinical assessment to an already great service. So that's in conjunction with MRAC and ROC, so the Medical Retrieval and Consultation Centre and the Remote Outreach Consultation Centre. And we're going to be launching this in the Berkeley and Central Australia regions, primarily as a primary trial. That's covering a geographical area of also almost 1 million square kilometres. So this will work very similarly to the William Creek trial. The alarm will be raised to the duty doctor, possibly via a telephone or via an alert on that iPad. And you can either be at the remote station, it can be yourself that raises the alarm, it can be somebody that's working with you, it can be a partner. It doesn't matter as long as that emergency call is made. Our software will then configure to the NT Health's video platform via Health Direct, and the duty doctor will join for a face-to-face video consultation. The initial face-to-face assessment with the duty doctor using either the office-based or the backpack option, with the camera, the speakers, and all those lovely diagnostic tools. And then if the clinical condition dictates that treatment is required, then immediate treatment can be commenced via that white chest, the emergency medical kit, and continued face-to-face assessment by the doctor via the telehealth option. MRAC can then be tasked for an RFDS aeromedical retrieval. And just as a note, the patient triage and health records are held securely by the NT Health system, and they won't be held by RFDS. So it will feed into the current service, and it will provide that additional layer of clinical assessment and reassurance. And that's reassurance for both the patient and for the doctor. Now, who can apply? We're looking for NTCA members who are based within the Berkeley or central catchment area of NT Health. You must already have an NT Health emergency medical kit or a white box. You should have some sort of Starlink or equivalent satellite connectivity. And there has to be a need for you to hold this on a trial period for 12 months. So if you live in the kind of area where you don't have many staff, you've not really made many calls to MRAC, you probably aren't going to be the kind of people that we're looking for. We're looking for people with lots of staff, lots of calls to MRAC. We need all that data so that we can then in 12 months roll this out as a second round. So you need to have that clinical need. Now the RFDS are going to fund the hardware component, and that's going to be an output of $250,000. What all that we're asking for is that you contribute $6,000 for your software licensing, and that's $6,000 for a year's worth of medical cover. So thank you for your time today. We've got a very short video which will demonstrate everything that I've just talked about in a much more glamorous way. I'd like to thank the NTCA for having me this afternoon.
This was the first time I'd ever experienced anaphylactic shock, and that's when my face had started to swell up and hives had started coming all over my body, and I had a massive rash just break out everywhere. I had one of the staff from the William Creek Hotel took me straight over to the clinic that the RFDS had recently built up there, and then that's when we went in to see the telehealth. You click the doorbell, you have a quick chat, and they let you straight into the clinic. I did my diagnosis straight away with the doctor, and they said get the adrenaline out straight away, measured a shot, and I had 3 vials ready to go. I deteriorated just like that. Eyes rolled into the back of my head, and they jabbed me straight away with the second one. It was a very full-on experience. The thought kept going through my head, what if the clinic wasn't there? What if I'd come last year? If the RFDS didn't exist, I'd most likely not be alive right now.
I tried to drink from a drink bottle, my lips are all numb. Got up in the morning to watch the sunrise, realised there's something wrong with my face. So I tidied up my tent and went over to the William Creek pub, and the publican came out and said, yeah, come with me, took me around the back, and there's a fully automated clinic there. As soon as you go in, the lights come on, the air conditioner comes on, the computer comes on, there's a blood pressure monitor, all sorts of instruments there if you need them. Doctor comes on the screen and asks me what's wrong, and she got me to do all these tests. Very reassuring also because she's actually right there on the screen, a real living person talking to you, you know. And within like 2.5 hours I had medication and a treatment plan. In the outback, left to your own devices with Bell's palsy, you could die. At William Creek is the most innovative thing I've ever seen. It makes the RFDS system unique.
I'm really excited about this pilot program with NT Health and the Royal Flying Doctors, and the partnership opportunity that presents itself for our industry. We're essentially going to have a critical care kit in a backpack, and for people who exist in those remote locations whose job is to travel out and stock camps for weeks on end, I know that's going to bring a lot of reassurance for those crews who pilot this program. My hope is that we're able to roll this out across the Northern Territory. Access now with Starlink and our connectivity is amazing, and this innovation will deliver immediate care when it's needed. That means we're confident when we send our people out that we've got the best care available for them. It means that our workforces feel comfortable and supported. We do really long, hot, heavy days, and having that there is just so reassuring.
Put your hands together for the RFDS.